Now, the suspension of healthcare services in Ibada-Elume is a troubling situation with far-reaching implications. Austin himself joins us right now to share more about his experience covering the story. Also joining us is Igho Akeregha, President Okpe People's Forum. First off, Austin, you're welcome. Thank you very much for putting together, first off, such a stellar report. And it's so sad to actually see that people absolutely need these services and can't actually access it because of a simple issue of theft. But tell us more about what you discovered that didn't make the report.
First and foremost, good morning and Happy New Year. Welcome to 2025. It's our first time of having this conversation in the year 2025. Ibada-Elume community in Sapele local government area happens to be one of the agrarian communities in Sapele in Delta State. And to be honest with you, that healthcare center, I used it while I was quite small, and it served as a reference point to other communities. And sometimes people who are on transit had some, very health challenges. I've been rushed to that place for first aid, attention. Very unfortunate. Over 4 months ago, we are doing a special report on the East-West Road, and we had a stopover, and we discovered that the place has been overtaken by weeds. And I was curious to ask questions about it. What happened to the healthcare center here at Ibada? And I was told that the nurses they shut down the healthcare center, and simply because their phones were allegedly stolen, and pressure was on the community leaders to provide them with those phones, and otherwise they won't return to work. And I took a self-video of it, which I sent to who that is concerned in the local government area and to the state government as well. Very unfortunate that for more than 3 weeks we didn't get feedback to know the situation. And of course, we have to do our job as journalists. I went back to the community. We met with various individuals. We spoke to a cross-section of respondents, which they told us what happened. And it was very difficult for us to gain access to government to tell us what happened. And the question here is this: how can a hospital, a healthcare facility be shut down for more than 4 months, and the local government chairman and the authorities seems not to be aware about this? Honestly, I doubt. But who are we going to question in this situation? Is it the matron who took the decision, or the community leaders who perceive to don't know what to do about it? This is healthcare facility for the people at the grassroots. And of course, when we spoke to them, they were just begging, because obviously some of them don't know what to do. And you can imagine that young lady who said that she wanted to give birth, and she went to the hospital, the primary healthcare center, and the place was locked. Imagine if she doesn't have the small cash within her to go to the nearby chemist. Imagine a lady putting to bed in a chemist. You know what it means? Because the chemist does not have the facilities. And most of those people, operating the chemist, they are not even qualified. Not to talk about the issue of putting 1 or 2 things in place for the incoming baby and the mother herself. So it becomes very difficult for the people of Ibada-Elume community to access primary health care at the moment, considering the weather we are into. You can imagine seeing those young ones, the children just playing around and vis-a-vis having some kind of symptoms of baby fever or diarrhea or whatever that is synonymous with those rural community health. Where will they get health medication? What the other person said, that they have to travel a very far distance to Sapele to come and get medical attention. And the roads are in deplorable state. The East-West Road we have been talking about for a very long time. For you to apply the East-West Road, you need to spend just within a kilometer or two. You spend nothing less than 2 hours on the road, and trucks are breaking down. So what if someone who is in their need of medical attention and the person is being rushed to a far distance hospital? How sure are you the person will make it alive? So these are questions we answer ourselves while doing this interview, and we said, why carry out this report? And we said it's necessary for us to bring it with the attention of the government, so that the healthcare facility in Ibada-Elume can be restored, so that people can have access to rural healthcare in those areas.
Right. Well, I mean, let's switch gears now because we understand that Igho Akeregha has now joined us. He's the president of Okpe People's Forum. Igho, if you're there, thank you so much for joining us. We appreciate you for coming on this morning.
Good morning.
Good morning to you.
It's
and Happy New Year to you, by the way. I mean, let's just start and talk about, these allegations of theft and, safety concerns that have been raised with the closure of this primary health facility. How is the community addressing these issues, and what steps are being taken to reassure health care for the community members?
Well, first and foremost, I'm the president of the Okpe People's Forum worldwide. The new central reporter, Austin Azo, I think he's done a good job. That is what we expect journalists to do, go into the remote area, the rural areas, and bring to the fore whatever that is happening in those communities. So to that extent, I commend News Central for that. When we got the report and then the news started running, as a pan-Okpe social, cultural, and political movement, we contacted the government, and we also got their own feedback. We tried to put pressure on the government to find out what exactly has gone wrong there. We sent our people, because we're embedded in the communities, we sent our people there to find out precisely what is going on with the Ibada-Elume Health Center. Yeah, the feedback that we got was quite positive. First, the community people informed us that the health center is running well, and then the services have been restored. And then on the side of government, when your report came out, I also listened to the director in charge of primary healthcare services, who said he visited the place, and that government was going to do whatever it can to ensure that services are restored. On our part, we got across to the government, and government officials informed us that first and foremost, that we have about 414 healthcare centers in Delta State. The Ibada-Elume Health Center is one of them, and it has since been running. Services were not as disrupted as the report painted. That was what government told us, that the services were not as disrupted as the report suggested. And if you also look at your report, we looked at it closely to find out if one of the impacted staff who claimed that their phones were missing and all that, we've been looking for them to talk to them. Whether indeed there was a theft, there was burglary in the place, up to now, we could not find any of the staff to speak to. So basically, the services have been restored there. The place is up and running. So it is good that the report came out. Don't also forget that Delta State is a multi-ethnic state with several urban and semi-urban areas. Ibada-Elume is one of the communities in Okpe and Saple local government. We have two local governments in Okpe. We have Saple and Okpe local government. And so whatever happens in any of the local government, as an Okpe embedded group, we are very interested. So this is one case that's of interest to us. But we are aware that, even the Delta State government itself, from the report that the station wrote that if the Delta State government, just last month here, won a $400,000 Bill and Melinda Gates Foundation, supported by UNICEF, for a healthcare leadership challenge. So it is not really as bad as it is being painted. But overall, it's a good report. It's good to put government on its toe. And I want to assure you that the Ibada-Elume Health Center is now back and running very well.
Mr. Igho, you seem to be switching sides in your submission there about the real accounts that happened with the closure and the events that just surrounding the healthcare center there at Ibada-Elume. And I'm going to let Austin Azu, give Austin Azu the right of reply, because there are some things that you said which is sort of indicting on his reporting. Austin, you have the floor. You have the right of reply.
Okay, first and foremost, after, airing the reports, of course, it went viral. Probably it took them few minutes or few hours or few days for them to, to reactivate the healthcare center. So for us, we are not aware if the hospital is, if the primary healthcare has started running. But I think what he just said right now, it means you have to revisit the place and get an update how the place is going. And of course, speak to the residents to confirm it, because of course we believe that the people of the community should be able to tell us, and not government officials who will just sit in their various offices. Of course, of course, they work with papers, and most of them hardly find time to go and visit. And that's why someone said that the president needs to go and visit most of the the public hospitals to see how they look like and other things. So most of our government officials hardly visit those areas. So they likely, get information from probably a third-party narrative and all those ones. And we are expected by now, and there should be, on the spot assessment of the place by the government officials. And of course, if they are going for the spot assessment, the media should be aware of what they are doing, because it was the media now that brought the attention of government to this event. And don't forget that they stayed for more than 4 months. And why did it take the government for more than 4 months to prevail on the health worker or to reactivate the particular area? So for us, it's another task for us to go back to the community, to go and speak to residents of the community, to find out from them if truly the place has been reactivated to attend to their health needs or otherwise.
Mr. Akeregha, I wanted to also touch on something you told about the fact that all the health centers in Delta State are up and functioning as far as you know, or as far as the authorities have let you know. But regarding the closure of the Ibada Healthcare Center here, it would seem that there were people who were supposed to have been getting paid that weren't working at all. After this report, you can see that that place is overrun with weeds, and it seems very derelict. So my question is does there seem to be a miscommunication somewhere between the health authorities, the LGA, your group, and also the communities? Do they not know that these health centers are not running, or this particular health center is not running? I'm hoping we still have Mr. Akeregha. Well, we might have lost him there. But Austin, let me redirect that to you. Do you think that it's a case of miscommunication or no communication at all?
Well, I think from what we gathered so far, the community themselves didn't make a proactive movement, because government has always said that you take ownership of government projects in your areas. And the community leadership, I don't know what happens to them, or probably they have taken side already, or they are trying to negotiate vis-a-vis due to the fact that the place was shut down for more than 4 months. We actually apportion, some percentage of blames to the community leaders, who ought to have, on the first day, reported the issue to the relevant authorities. And however, I don't think this issue would have lingered for this particular time that it stayed. And from what Igho Akeregha just said right now, like I said earlier on, we have more tasks for us to go and verify the statements that we just made, and we'll go there and see things for ourselves and speak to residents as well to confirm that. But we will not just go there and see a gate that is opened. Maybe we'll not see health workers. And don't forget some of these issues we have at the rural areas regarding government project facilities and other things that has to do with government functionaries in the local areas. You hardly see people at the local areas, particularly staff, who are committed to duties. Most of them will always do this ghost working, and some of them will just come in and graze out without giving proper attention to what they are asked to do or what they are being paid for. So the community leaders or any other community who might experience this kind of challenge should be able to, meet it at the board, speak up and meet the relevant authorities, and put pressure on who needed to be, called upon to reactivate whatever issue that might have happened that led to something being closed down, or office or facility being shut down over, probably based on issues that needed not to.
I must say thank you, Austin, for just taking out the time and just talking to us today. And also very thank you for, just keeping an eye out and giving us all this developmental journalism and reporting. We appreciate you for your hard work. And also to our other guest, Igho Akeregha. Unfortunately, we lost him there, but many thanks to you, sir, for joining us.